Hello everyone. Today's video is about 50 questions on vaccines. Oral polio vaccine, Sabin strain is the strain used here, and type 1 and type 3 polio virus are included in the current bivalent vaccine. It's contraindicated in immunodeficient children because it is a live attenuated vaccine. Okay, it's a live attenuated vaccine, so not given in immunodeficiency. Inactivated polio vaccine is the injectable polio vaccine, and the strain used is Salk strain. Tdap is recommended in the third trimester of pregnancy because the pertussis, there is no protection of pertussis in pregnancy and to the newborn. So Tdap is recommended instead of the previous TT or TD recommendation, and it can be given in every pregnancy irrespective of the previous immunization status. BCG vaccine contains live attenuated Mycobacterium bovis, and the strains used are Pasteur, Danish and Tokyo strains. Okay, Mycobacterium bovis. BCG should be administered at birth or ASAP before 1 year of age. So in children less than 1 year of age, you give 0.05 ml, and more than 1 year of age, the dose is 0.1 ml, and it is given intradermally. It's an intradermal vaccine, 0.05 ml and 0.1 ml in older children. Okay. Absolute contraindication to BCG is severe combined immunodeficiency, again because it is a live attenuated vaccine. Most common adverse effect of BCG vaccine is ulcer with scar formation. After constitution, BCG vaccine should be used within 4 hours. BCG protects against TB, meningitis and miliary TB, which are severe forms of the disease, but it does not reliably protect against pulmonary TB. It cannot stop from the pulmonary focus from waking up. Okay, so especially in adults and adolescents, BCG does not protect against pulmonary tuberculosis. Hepatitis B vaccine is a recombinant subunit vaccine, and hepatitis B vaccine indirectly prevents hepatitis D infection, because we all know that virus D virus requires hepatitis B virus for replication. Standard hepatitis B vaccine schedule is 0, 1 and 6 months in adults. Okay. Greatest advantage of OPV is that it interrupts transmission and it builds mucosal immunity, the secretory IgA, and it interrupts transmission. OPV, the phenomenon of herd immunity, is seen with oral polio vaccine. Circulating vaccine derived polio virus is because of genetic mutations of the virus in unimmunized population. Genetic mutations of the virus in unimmunized population is the cause for circulating vaccine derived polio virus. Type 2 polio virus is eradicated globally, and now it is not a part of the oral polio vaccine, and that's because it is eradicated already, and maximum cases of this VAPP and VDPV were seen with this virus, so that is not a part of the biopolio, the oral polio vaccine now. Major contraindication to OPV, again immunodeficiency, because it is a live attenuated vaccine. OPV requires multiple doses because the maternal vaccination as well as enteral factors like malnutrition, diarrhea, feeding, etc., that can reduce the take of the vaccine. So multiple doses are required for seroconversion. Measles vaccine is given at 9 months of age because maternal antibodies wear off. MMR is a live attenuated vaccine. With MMR vaccine, vitamin A dose is given. Second dose of MMR is given at 16 to 24 months. Measles vaccine is given by the subcutaneous route. The MMR vaccine is given by the subcutaneous route as a 0.5 ml dose. Also, which is the other vaccine given as subcutaneous route? The varicella vaccine. The chickenpox vaccine is also given as the subcutaneous route. Most common adverse effect after measles vaccine is fever with rash. Somebody, if they are in contact with a measles infected child, the post exposure prophylaxis should be given within 72 hours of exposure to the measles vaccine. Egg allergy is not a contraindication for the MMR or flu vaccines anymore. Vaccines that are safe in pregnancy are TD, Tdap, TT and inactivated influenza vaccines. The mumps vaccine uses the Gerillin strain, measles vaccine uses the Edmundston strain, and rubella vaccine uses RA27 3 strains. Now this is something you have to mug up. Mumps is Gerillin, measles is Edmundston, and rubella is RA27 3. Typhoid vaccine, it utilizes the VI polysaccharide conjugated to the carrier protein. VI polysaccharide conjugated to carrier protein. Okay, this is the typhoid conjugated vaccine. Minimum age for giving the TCV is 6 months. Okay, and it can be given with the influenza vaccine at 6 months. TY21A is the oral typhoid vaccine and it is live attenuated vaccine. Polysaccharide vaccine of typhoid, it uses the VI capsular antigen. The polysaccharide vaccine of typhoid utilizes VI capsular antigen. The advantage of TCV is that it can be given below 2 years and it has lasting immunity compared to the polysaccharide vaccine. Okay, that is the advantage. It can be given below 2 years, whereas the polysaccharide vaccine can be given only after 2 years of age. Pentavalent vaccine, remember that this includes diphtheria, pertussis, tetanus, and the 2H, that is H influenzae type B and hepatitis B vaccine. This does not include polio. Remember this, pentavalent vaccine does not include the injectable polio. Okay, DPT and the 2H, H influenza and hepatitis B. The Hib component of this pentavalent vaccine, it is a conjugate vaccine. Most common adverse effect after pentavalent vaccine is local reaction, fever, local redness, swelling and pain. That's the most common adverse effect. Fractional IPV is given as the intradermal vaccine. Okay, fractional IPV is given as intradermal vaccine, and IPV is given in the government schedule at 6 and 14 weeks of age. IPV is given at 6 and 14 weeks of age. So that's all for today, and the next and the last video in this series will be posted tomorrow.